It's just that I have not known any other profession. My parents are doctors, my granddad's a doctor, my uncle's a doctor, my great grandfather was a doctor. Had no idea what people from other professions do. Obviously, with the family background, my first choice was I didn't get in, I got into dentistry. After my first week, as things happen, the lists start coming up, first list, second list, third list. In those 1 or 2 weeks, I felt like this is where I belong.
And the duration for this one is?
About 2 years.
2 years?
Yeah. My husband, my parents, and Bapu. Those were my 3 rocks.
Yeah.
And then this big post came in and it had Dr. Neha Murudkar written on it. And I said to my mom, "Mala kontari doctor banta."
People or the new doctors which are coming either from India or anywhere, what would be your advice to make their sail through little bit better?
Patience and...
Welcome Neha, welcome to Bald Waker.
Thank you for having me.
Most welcome. Now, because you come from a family of doctors, was there a pressure that you got to be a doctor as well?
Not really. There was no pressure from the family. The pressure was from my own self.
Okay.
I wouldn't even call it pressure. I would just call it interest.
Okay.
It's just that I have not known any other profession. Right?
Okay.
My parents are doctors, my granddad's a doctor, my uncle's a doctor, my great grandfather was a doctor, right?
So you have a legacy.
Yes. So I had no idea what people from other professions do.
Okay.
Right?
Okay.
So it was
blessing.
So it was interest on my part that put that pressure on me. But otherwise from family there was absolutely no pressure. But I always loved biology, medicine, that side of things. And I was just brought up with it, so it's something that just came organically to me.
So when did you decide, or that thought came up to a mind that because your dad, I know, your dad is a heart surgeon, your mom is a doctor as well, she's a renowned doctor in Mumbai. When was the first thought came up that, look, I need to give like a serious thought of, forget about dentist, but going into a medical field?
So I would probably say after year 10. So after year 10, when you go into what's called in India as junior college, right? There was never a question in my mind whether I wanted to go to science or arts or commerce. It was always going to be science, right? So did that. And then there's this bifurcation of PCB and PCM.
PCM, yes.
Right? Maths was never my strong suit. I never enjoyed it. Therefore, I didn't do well in it. Right? So that was not a question for me. On the biology side, I went through this phase of, doctors are really busy, they don't have time for family, maybe I want to do something else on the biology side, but maybe something else, whatever. But then as year 11, year 12 started to progress, I felt like, I definitely want to do either medicine or paramedical field. I really do enjoy it. And it is something that I could see myself doing for the rest of my life. So, yeah.
How tough or how easy it was to become a dentist?
So getting in is also obviously extremely difficult.
Yes, open category.
Yeah. So it is challenging in every which way. But again, it depends on whether you enjoy it or not. So when I got into dentistry, obviously with the family background, my first choice was medicine. Right? I didn't get in, I got into dentistry. After my first week, as things happen, the lists start coming up, first list, second list, third list. So I'd settled myself into a dental college, and then the list started coming up, and then there was a discussion in my family whether or not you want to move. But in those 1 or 2 weeks, I felt like this is where I belong.
Okay.
I did not expect that. I took up dentistry purely as a second option to start with, but I felt at home.
Okay.
And that's why we decided, no, this is what I'm going to do. Of course, there were phases. As a student, again, I really did enjoy medicine subjects more than dental subjects.
Okay. Yeah.
So I did exceptionally well in year 1 and year 2, where you have more of medicine subjects. Year 3, year 4, academically, I used to miss the medicine subjects. And there was that time when I was like, oh, should I have? Did I do the right thing? But once I started practicing, again, that was home for me.
Yep.
A dental clinic is home for me. That's my comfort zone. I feel like, at least in this particular birth, this is where I belong.
Okay. So when you finish your BDS, of course, after that you got married and then you came to Australia.
Correct.
Being a doctor in India versus being a doctor in Australia.
Right.
How different it is, and before that you basically had, I'm not sure if you had to do any exams or how was that journey?
Okay.
I'm sure I've heard that it is one of the problems, or it's a difficult phase.
It's a challenge. It's a challenge for sure.
What it is?
So look, it is a journey, that is for sure. Not without its challenges. It is a fairly long process. It involves multiple steps. It has changed a lot over the last 14, 15 years.
Yep.
When I started my journey back in 2009, 2010, it was a bit different to what it is today.
Yep.
More or less the same beats, slightly different in the way they conduct the exams now.
Yeah.
But the basic process is still the same. You submit your documents, your degree from India. They assess it. They say, okay, this is a valid degree. That's your assessment part done, right? Then you're eligible to sit for the exams.
There is an exam as well.
Yeah. There's a series of exams.
Okay.
So when I did my ADC, there was an English test that you had to start off with, which
like
was called
IELTS?
It's slightly different to IELTS.
Okay.
It was called Occupational English Test,
okay.
right? So in that, it was basically like IELTS, but it had occupation-specific questions.
True.
So, for example, the writing task used to be a letter of referral.
Yep.
A speaking task would be a role play between the dentist and the patient. So they wouldn't test your knowledge on dentistry. They would just test your knowledge on English.
Okay.
But it was pertaining to the particular profession.
Okay.
And then once you cleared that, then you did part 1, which is a theory exam. And then once you cleared that, you did part 2, which is a clinical exam.
Yep.
Now what's changed from what I have heard from the current lot that's going through it is that you don't have to do English test right at the beginning. You do your part 1, you do your part 2, and then before you get the license, you have to do the English test, which has also changed now. They don't do OET anymore. You can either do IELTS or you can do, I think, PT. The new one is called. Yeah.
Yes.
So those are the ones that you did.
And the duration for this one is?
The English.
The whole process.
So it depends how quickly you clear it.
Okay.
Right. So on an average, I'd say from the time you start to the time you finish, if you finish everything relatively quickly and if you pass everything all right, I'd say about 2 years.
2 years?
Yeah, it's a process. Yeah, because by the time you get, you apply for one exam, you get your dates, you get the result, then you apply for the next one, then you get your dates, then you get the result, then you apply for the... so it's a process. It's not instant.
Okay.
So it is important to have the infrastructure and the support system in place, right?
Support system means family?
Family, absolutely, 100%. You cannot do this without your family's support.
Okay.
In my particular case, I was extremely blessed to have my husband, touch wood. He's my rock, right?
Yes.
He's always been my rock.
Yeah.
He was standing behind me. And because he was... we already had permanent residency when we applied offshore because he's an electrical engineer. He had the relevant experience. We were able to apply. I was fortunate. We got, so I had the PR side of things done. And he was already working as an engineer, right? So I could focus on my part of things.
Yes.
So it was a partnership, right? So my success or my... achievement is not my own.
Of course.
It's his as much as it's mine.
Of course.
And my parents. I cannot imagine what I would have done without my parents.
Yeah.
My mom used to come and stay with me for a couple of months prior to the exam, so I don't have to do cooking, cleaning, laundry, all of those
Good
things.
on you,
I can
mommy.
study. Yeah, exactly, 100%. I honestly, and it helps as well if you have a little bit of a spiritual, a little bit of a, spiritual support as well. In my case, we follow Aniruddha Bapu, so that was my support as well. So basically, my husband, my parents, and Bapu. Those were my 3 rocks.
Yeah.
I would not have been able to be where I am without them.
Yeah.
So yeah, with all of that in place, I was very fortunate to have done this. I still remember, because when I got my results, they used to send the results in post.
Okay.
They would not.
Yeah.
It was like
Yeah.
medieval ages, right?
Okay.
So they didn't publish it on the internet. They
Yeah.
would send it by a post. And I still remember, like, the week when the result was expected, my mom and we would be standing, and we lived in this house that was on a corner.
Okay.
And the postman would go, so it was a no-through road like that, right? So he would go like that, and then he would drop the post, and then he would come
to
and
you.
he would come to me. So we would stand in the kitchen and wait for the postman to do his round and then come out. And then my mom and we would run out, and we would just be standing outside. And the thing with these guys is that until you pass your Australian Dental Council exam, they don't call you, they don't address you as doctor. In correspondence.
Till that time, you're just Neha.
Correct. So they will say Mrs. Neha Murudkar.
Okay.
That is how they would write their correspondence,
Yes.
right? And so all the letters prior to my ADC, result, everything, all the assessments and everything that would come would be Mrs. Neha, Mrs. Neha, Mrs. Neha. Okay. And then this big post came in, and it had Dr. Neha Murudkar written on it. And
Tears in your eyes?
I still cannot explain what I felt when I saw that.
Yeah.
And I said to my mom, "Mala kontari doctor म्हणताय. Someone's calling me doctor. Someone's calling me doctor." And then we opened it, and then we read the letter. I rang Abhi, and then he was at work. And then his boss said to him, "What are you doing here? Go home, go home." And then literally he sent him home, and then, we all sort of celebrated. And it was a moment that I don't think I'll ever forget.
Of course.
So it's a process, and it requires the kind of support system. And with women, unfortunately, what happens is, 20s is the time when they're getting married, when there's family pressure to start a family. And it's not just family pressure; it's biological pressure as well. It's just the way science works. You have that's the time between mid-20s to mid-30s, and when you're supposed to get married, have babies. But that's also the time when you're supposed to shape up your career.
Yeah.
So it is a little tricky for women. I have so many friends of mine who did their pregnancy and everything during the ADC process.
Okay.
So because we started the process a little bit early on, as soon as I finished my internship, we started this process. I was fortunate enough to have finished it, and then I had my first child.
Okay.
So I was fortunate enough to be in that situation, but not everyone is. Sometimes, people work for a couple of years. They're 26, 27, they think, what, I feel a little stagnated, I want to try something different. And that's when they try this. And they're sort of around that 30-year mark, when unfortunately, there's that pressure of having a family, all of that. So it's a very real struggle for which you need to have a very supportive family.
So people or the new doctors which are coming either from India or anywhere in Australia, where it's not Commonwealth country, I don't think their degree would be judged here and stuff.
Correct.
What would be a person who had been through the process?
Right.
What would be your advice to make their sail through little bit better? What's your advice?
Patience, a lot of patience, and faith.
Okay.
Faith in
Almighty?
Whatever power you believe, exactly. Because if you don't make it, it does not mean that you didn't deserve it.
Yep.
Okay. Unfortunately, it is just the requirement of the country at the time. What time of the year you give your exam at, how many candidates pass out, who are the people that are with you that are giving the exam. If somebody who's really experienced, who's really good is standing next to you and they're giving their exams and you're giving their exams and you're just a new grad who barely knows the names of the products that are used in practical dentistry, then of course you're going to fall short. It doesn't mean that you're not a good dentist or that you will not be a good dentist. And the nature of exam is very different, right? In India, we are used to giving exams a very theoretical way. There's no practical component to it,
Yep.
right? It's all about classifications and rare diseases, and it's always about zebras, not horses, right? How well do you know the zebras?
Yep.
That's what the Indian exams are like. Whereas here, it's always think horses, not zebras, right? So you have to think common things. Common things happen commonly.
So make those changes.
Yes. So you have to, your thought process has to be more practical oriented. So I would say if you can work in a practical environment for a couple of months at least.
Before coming
here. Or even I would encourage people to work as dental assistants.
Here?
Here.
They are eligible to do that.
They are eligible. Now things have changed. People are a lot more open to hiring dental assistants who are overseas trained dentists. Back when I did mine, that was not the case. Also, what used to happen is any certification to become a DA would be, you couldn't just enroll yourself to become a DA in a university or in TAFE or whatever, right? You had to be on the job, and then the job employer would have to send you to that course, right? So you had to have a job to get the relevant certification, right? And then no one was ready to invest in overseas trained dentists because once you invest in them, you send them to TAFE to do the course, you spend a few years and then they pass out and then they leave. So no one wanted to do that. And then it was like, oh, maybe you shouldn't tell them that you're, an overseas trained dentist. And then what do you say? You say you've done dental assisting, but you haven't. Nobody tells you that dental assisting is a completely different skill set. And dentists are not equipped to be a dental assistant.
Can you please elaborate a bit?
Okay, so I always say to the girls that I work with, I always say they're beautiful DAs. I say to them, if I had to do your job, I would be fired in one day.
So do you get dentists who are overseas as well as your DA?
Yes, we do. And now, because the practice that I work at, Pacific Smiles, they are very good with employing overseas trained dentists as DAs. A lot of girls that work with me are overseas trained dentists. They work as dental assistants for me. Fantastic girls. But they get trained to do dental assisting as well, right? So holding a suction is not just sucking spit. It takes a lot of skill to do that. It takes a lot of skill to anticipate what the dentist is going to do, be quick on your feet, to be agile, to think ahead, to think one step ahead. It's a skill set that needs training. Dentists are not equipped to do that. Dentists can do it. They know how to do it. But they need to be told or taught how to do it. To be on each side of the chair, you require a different skill set.
So if you are a dentist overseas, you're coming here, you're working as a dental assistant.
Right.
Do you feel little bit sort of undervalued, or what are they feeling? If I consider myself that I'm a dentist overseas,
right?
But this is a very small stuff which I'm doing.
Correct.
Overseas.
I get where you're coming from, and the thing is that it just depends on whether you want to do. So if you look at it as a stepping stone, right? I'm working here for the next 2 or 3 years whilst I'm gaining my dental knowledge,
experience.
That's paying my bills to do my exam fees, and I'm going to do my exams. I'm getting knowledge from all the dentists that are working. The girls ask me so many questions. I tell them about my experience. We're just bouncing thoughts off each other, just like, just talking to each other. Sometimes they ask me, they look at an x-ray and they ask me questions. I answer their questions. They say, oh, this is the question that we came across. How would you answer this? So we just talk about things. If you use that as a learning curve,
then it's fantastic.
If you are in a situation where, for whatever reason, you feel like, I don't want to pursue ADC, then I think it would be sad, because if you're a dentist overseas, you're working as a DA for the rest of your life, then sometimes, I don't know, again, to each their own. Some people are happy to do that because at least they're working in the field, they enjoy working with the dentist, they stay in touch, and they feel like, this way at least I'm in touch with everything. If one day I decide to go back to my country, my knowledge is not, null and void.
Wasted.
I keep it going. So that's how they look at it, and that's great as well. To each their own. For me personally, if I would not have done ADC, I would not have chosen to work in the field of dentistry at all, because like you said, I would have felt like I'm not doing what I really want to do.
Yes.
So it makes me sad.
Makes sense. Okay.
So yeah, again, to each their own, but
Person to person, it changes as well.
but coming back to your original question, working as a DA whilst you're going through the process, fantastic idea, because it really, really gives you an idea of how dentistry is practiced in Australia.
That was my next question.
Yes.
Coming back.
Yeah.
Okay.
So, we keep digressing, but
No, that's okay. That's okay.
But it does give you an insight into how dentists here think. And how they work, because all of your questions are very practical related. Even the MCQs, like when I gave my exam, the MCQs used to be more theoretical.
What is MCQ?
Multiple choice questions.
Okay.
For part 1.
Yeah.
Right. And now they're more practical. So something like, if you're working on a patient and if the mirror falls down, what will you do?
Yeah. Yes.
Just will you kick it to the side? Will you pick it up instantly? Will you, just little things like that. That when you finish your internship from a dental college and you come out and you haven't ever worked, you have no idea.
But then the question here would be, how it is different to do a practice in India and practice in Australia. Forget about people. Yes, there are Goras, there are Indian people. Forget about race, forget about background stuff. But how is it different? What are the good things and what are the probably not so good things?
Okay.
In both ways.
So again, my answer might not be the most unbiased because I haven't practiced a lot in India.
But you've done
I have done my basic graduation.
Yes.
I have done my internship, and I worked for a few months under a few dentists and in a charitable hospital. So I've done a little bit of work in India. Most of my practice is
which is probably a year. In India.
That's correct. Okay. Yes. But again, going back to India, speaking to different people, my family members, friends, family friends, all of them, patients that I see, Indian patients, it is different. Preventive dental care is not as much of a thing in India as it is here. It's changing, but there's less number of people that go in for their regular checkups and cleans every 6 months as compared to here.
Okay.
Right. Even Indians here, I feel there's been a massive shift post-COVID.
Okay.
Right? Because the thing was, people would always compare the costs.
Yeah.
Right? But obviously, the overheads here are very different to the overheads in India.
Yes.
So no one can ever match the cost, right? So people what they would do is, every 1.5 year, they would go to India, they would see their local dentist, they would be like, just get me fixed up so I don't have anything to worry about for the next 1.5 year.
Yep.
They'd get it done, and then so on and so forth. COVID broke that cycle, right? Because people weren't able to go back home for 2 years or so, right?
Yep.
And then they realized, okay, we need to see a dentist here. And then they realized, okay, this is not so bad. We can do this, If I have hospital cover, I can just add a few extra dollars. I can get, dental cover. I can see a dentist here. That way, if I need some upkeep, at least I'm looking at a dentist here. Just in general, the approach is quite conservative and preventive
in
Australia.
Yep.
Because it's not because the dentists in India want to not be conservative. It's because they don't get a chance to be conservative.
Okay.
The patient only goes to them when they have
there's a problem.
When they have a full-blown toothache. They wouldn't even go if they're getting food stuck in there, right? If the food getting stuck in there is probably because of a cavity that you have, or because of, gum recession. They don't go at that stage. They don't go until it starts to hurt.
Yeah.
So then obviously the dentist has to only do root canals, has to do extractions, has to do dentures, has to do implants. You don't give them a chance to do little fillings and, a nice little clean, getting you out of the chair in 20 minutes, no pain. You don't give them a chance to do that. Yeah. So obviously that's the difference. That's the main thing. Apart from that, obviously, in general, again in India, India is is such a wide spectrum.
Yep.
You get dental clinics that are even more expensive than dental clinics in Australia.
Okay.
And then you have dental clinics that will do a clean for 50 rupees, which is like $1.
Yep.
Right? So you have one end of the spectrum to the other.
Mm-hmm.
Depends on where you're going and who you're seeing.
Yep.
There's obviously the time constraint as well, especially for people who live here. When they go there, they're usually going for about 4 weeks. They don't see the dentist in the first week. Obviously, they're getting settled in, they're meeting their family, then week 2, maybe they're like, let's go to the dentist. They'll go to the dentist and they'll say, I'm only here for 2 weeks. Sometimes they'll go a week before they're flying out and they'll say, I need a root canal and a crown, but I only have a week. So, it's different. So the dentists there have their own challenges, especially when they're dealing with the NRI demographic.
Yep.
So it's vastly different.
Okay. So if people from India or even in Australia are looking at this podcast,
right,
what are the things you would 1000% recommend to them when it comes to dental health?
So many things.
Okay,
we'll start with brushing. Okay, brushing twice a day with a fluoridated toothpaste. Okay, most of your standard dental toothpastes have fluoride at the recommended dosage. Colgate, Oral-B, McLean's, all of them.
Yep.
There's usually not one that's better than the other. They're very competitive. They're pretty much the same. Whatever taste, flavor you like, whatever's on specials, you can buy it. Twice a day. Flossing. No one flosses. Please.
Even in Australia?
Well,
okay. All right.
In India, definitely no one flosses.
Okay.
No one flosses in India.
We haven't heard that concept.
Correct.
We've heard that concept when we came here.
Correct. We weren't taught that in uni either, right?
Okay.
So flossing is extremely important. You're not cleaning 40% of your teeth if you're not flossing.
Is it?
Right? Because your molars are box shaped, right? These interproximal surfaces that are sort of contacting, you can brush here, you can brush here, right? All your zigzag bristles and everything they're not going to go in the contact, right?
Okay.
So the only way you can clean that contact is when you get in there with the floss. Okay? There's lots of myths associated with flossing. People feel like flossing creates gaps in the teeth. Does not create gaps in the teeth. It cannot possibly, it's a piece of satin or whatever, right? It is not going to create a gap in between your teeth, right? There's bleeding when you floss. Everyone bleeds when they floss. Okay, it does not mean that your teeth are too tight to floss, so therefore you shouldn't floss. It does not mean that you don't know how to floss, therefore you shouldn't floss. It doesn't mean that it's the wrong kind of floss, therefore you shouldn't floss. You should always floss.
Okay.
If the gums are bleeding, it's because of gingivitis. Okay, so it's like a vicious cycle. You've got plaque and tartar, therefore you get gingivitis. Gingivitis is inflammation of the gingiva of the gums as a reaction to the plaque and the tartar. When you remove the plaque and the tartar, that inflamed gum is going to bleed because inflammation has increased blood supply. So it's going to bleed, right? If you keep at it for a week, right, you'll notice by day 3, day 4, the bleeding will reduce. By day 5, day 6, the bleeding will stop. Right? Then again after that, if you're slack for, let's say, a week or a fortnight, you get busy, you get whatever, and then you start flossing again, you're going to bleed again. It's okay. Keep going. And you'll find that eventually, because of the plaque and the tartar reducing, you'll get less resistance, therefore less chances of the floss slipping and hitting your gum. You'll have better control. And also the plaque and the tartar reducing will sort of make the gums bleed less, basically, right?
So floss is one thing.
Interdental brushes, they're fantastic. They're
What
such a
do you
blessing.
mean by that?
So interdental brushes are basically little brushes that have a little plastic handle and the end of it has little bristles.
Yeah, gotcha. Okay,
so it's basically a toothpick with bristles.
Yes.
Right?
Yes.
Now, toothpick in the Indian demographic is an extremely commonly used
Of course,
tool.
we all do that. Of course.
Please do not do
Okay.
that. It's so common that obviously when I was growing up, I don't know if things are very different now. I have not seen the toothpicks being given at the end of the meal in
Of course,
restaurants
they
anymore.
still do. Come on.
No.
They still do.
Okay. Maybe
Whether you use it or not, it's your call.
Yeah, but they always used to give toothpicks at the end of the end of the meal, right?
Yes.
It creates it massively damages the teeth, right? Because what happens is when you get food stuck in there, you
Yeah.
stick your toothpick in there, right? These are your teeth contacts, right?
Yeah.
You stick your toothpick in there, you're sticking it and sticking it and sticking it and sticking it, and then you're kind of abrading the neck of the teeth.
Okay.
And then you're creating a circular hole, right? It's going to get more food stuck in there. What are you going to do? You're going to put a bigger toothpick, or you're going to take the same toothpick and move it around.
Yes.
Until you scrape everything off. And
Yep.
you're scraping your teeth off as well with it. And you're making the hole bigger and bigger and bigger. You're pushing your gums down.
Okay.
Right? So instead of that, if you just use those interdental brushes, which have soft bristles at the end of it, you're doing essentially the same thing without the damage.
Okay.
And they come in different sizes.
Yes.
So if you use the smallest size, it's less likely to damage. And
Yeah.
then some areas, if you've got a little bit of rotation of the teeth causing a bigger gap where that brush is not big enough to scrape everything, one, you can also move it around.
Yeah.
But also if you want to use a bigger size brush, you can use a bigger size brush.
Yeah.
You can buy a variety pack to start with, which has
Yes.
different sizes. Try it, and then whichever size you use most is the one that you
Is the
buy.
one. Yeah.
Sometimes your dentist can even give you free samples.
Yeah.
If we have it. But
Yes.
the reps are not that generous with the samples anymore. But when they are, we tend to give
Right.
it out to patients who, we feel like
Need
they would benefit from
Sure.
it. Water floss. Water floss is not bad either. Water floss is quite good. It basically, if you don't like manual flossing, you could use either a manual floss or the floss with the handle.
Yes.
Right?
Yes.
That's also easy to maneuver.
Yep.
If you don't like using that, you can use water floss. Okay.
So you get like a brush or some like
Yeah.
a equipment which
Yeah. So water floss, basically it's got a handle, and at the end of it, it's got like a little nozzle through
Yep.
which you get like a high speed water jet coming
Oh,
out,
okay,
right?
okay.
So you sort of direct it in between the teeth, and then that high speed water jet will sort of wash through in
Okay.
between the contacts.
Okay.
And that sort of cleanses the
So
plaque
which
and
one
the
is
tartar.
more effective?
In my opinion, I personally like the physical floss better.
Yeah.
I don't mind whether it's the string or the ones
Or
with a
the-
handle.
Yep.
The reason for that is, what I normally recommend is brush your teeth, right? Spit out your excess toothpaste.
Yeah.
And whilst you've still got a little bit of toothpaste on your teeth, that's when you go in there with the floss.
okay.
So what it does is it pushes the toothpaste in between the teeth, right?
Okay.
And the fluoride in the toothpaste reverses the decay. All right? So,
Great tip.
yeah.
Great tip. Thank you.
Yeah. So basically what happens is when the decay begins, right? Most of the times it begins in between the teeth.
Yep.
For the same reason, because most people don't floss, they can't get in effectively with their toothbrush, doesn't matter how hard they try. So the contact is always the starting point of decay.
Yep.
You've got your enamel, you've got your dentine, and then you've got your pulp, which is the nerve, right? Now, the enamel doesn't, let's just say it's the most calcified structure, okay? So it's the hardest.
Yep.
It's the toughest to break through, okay? Dentine is softer, okay?
Okay.
And once it goes into the nerve, done.
Yep.
Root canal or extraction,
Yep.
okay? Whilst the decay is in the enamel, we call it early enamel caries.
Okay.
Okay?
Yep.
It's reversible. Okay? It's the only time when it's reversible. Right? Sometimes we can actually reverse it. Sometimes we arrest it.
Okay.
Okay? In order to do that, we need fluoride crystals. Okay? So we need fluoride to make the enamel crystals stronger and more resistant against cavities and sensitivity.
Yep.
So when you provide the physical cleansing with the floss as well as pushing the fluoride in,
Yep.
you're sort of giving the enamel a chance to heal and solidify and arrest the decay.
Okay.
Once it goes past the enamel into the dentine, you have to have a filling.
Okay.
Okay, you can't arrest or reverse the decay once it goes into the dentine.
Yep.
Okay. And then, like I said, if it gets bigger and bigger, and that's when you start getting symptoms. Usually when it's in the enamel, there's usually no symptoms.
Okay.
And that's why it's also important to get your x-rays done every 2 years.
Okay.
So when you see the dentist every 6 months for a general checkup and clean, they don't necessarily have to do x-rays.
So that is a third tip.
That is correct, yes. So they don't necessarily do x-rays at every visit. They shouldn't be doing x-rays at every visit under normal circumstances, unless there is some exceptional reason for them to do it, then they'll do it. But otherwise, six monthly checkup and clinically evaluating the teeth. And every sort of 2 years or so is when we like to do some x-rays.
Okay.
So those x-rays help to check in between the teeth and underneath the fillings. So if there is any hidden decay that's hiding in between the teeth that we can't clinically see, it helps us pick that up at an early stage.
Okay, need to do it next time.
Yes. And then that's when we say, okay, these are the spots. We show you the x-ray. We say, okay, these are the spots we're monitoring. We need you to get in there with the floss and really go really intense in there. Just make sure you kind of, look after it. And then we reassess it clinically and then radiographically again. And then if we feel like it's getting bigger, it's gone into the dentine, that's when we do the filling. Otherwise, we just keep monitoring it. There's so many times when, the patients come in with something, we kind of pick it up, they're monitoring, and they get away without the filling for 2, 3, 4 years. At some point, it usually does need a filling. But even if you can postpone a filling for 3 or 4 years, why not?
Okay, gotcha.
So that is something that, and then if you're seeing the dentist every 6 months, they will do it for you. They will automatically tell you that you're due for x-rays.
Sure.
Just don't question them and think that they're doing it because they want to find something in your mouth.
Okay, understood.
Because for me, I feel like I'm the happiest when I say to the patient, you don't need any work. Because I feel like I've done something right in the previous visit when I've educated them, right?
True.
So for me, that's the happiest I am when I have to tell them that you don't need anything. But when if I don't tell you if I see something, then I'm not really doing you a service. If I just do an examination and say everything looks fine and let you go, and then that small cavity that could have been picked up in an x-ray, we don't pick it up, and the cavity is in between the teeth, you've got this shell of enamel sitting on the top, right? I've looked at it and I've said, enamel looks good, from the top everything looks fine, you can go, you go away, you go home, you bite down on a nut, that shell of enamel breaks. There's a cavity. You're going to come back to me and say, I just came to you 2 weeks ago for an exam. What happened? You said everything was fine. What happened is we didn't do the x-ray because you didn't let me do an x-ray. Right? So then you have to make sure that you kind of go by the recommendations of the dentist. Trust them. Of course, I'm not
Listen
saying...
to your dentist.
Don't blindly trust anyone. But if you have a rapport with the dentist where you feel like they have your best interest at heart, go with their recommendation. Don't second guess everything.
Which, when you talk about the fluoride and and different toothpaste,
you're right.
I've got a question. I'm not sure if it's controversial or not.
Oh my God, I know what you're gonna ask. I know what you're gonna ask. Okay.
When you use different toothpaste,
right?
Is that one of the reasons for cancer?
No.
So it is a myth.
100%.
Okay.
So look, anything that has clinical trials behind it, you should be able to trust it safely, right? Causation and correlation are two different things. Okay. For example, it's a 40-degree day. Right? People are eating lots of ice creams. It's a 40-degree day. People are getting sunburns. Okay. 40-degree day is the causation for ice creams and sunburns. Correlation.
Yes.
Since people started eating ice creams, they've been getting sunburns. Has ice cream caused a sunburn?
No.
So that's why when they do clinical trials, they do it in a certain way where they're sort of looking at, okay, this happened and this happened, but how many people did it happen otherwise?
Okay.
So they isolate things. I mean, I'm not a clinical trial person. I have never done research and development and all of those things. My dad is the boss with that. But basically just the way the trials are conducted, they have to go a certain way where they're eliminating all of these things, and then they have to put a product in the market only after that. So as long as you're going with standard brands that have been around for many, many years, you're fine.
Okay.
There's people who say, oh, I've been having some skin issues, so they've said, oh, maybe cut out the fluoride, maybe that'll help. Look, to each their own.
Mm-hmm.
I don't have a problem unless I see a problem in your mouth.
Mm-hmm.
Okay?
Yep.
I have had patients who have been with me, who've been seeing me for years, no problems. All of a sudden, 3 cavities. What's changed? Oh, I've cut out fluoride. It's, they said, my naturopath said it's extremely toxic for you. What about these cavities? They're toxic for you.
Yeah.
So you have to assess risk versus benefit.
Okay.
So that is something that I would, there's been so much research behind it.
Mm-hmm.
It's evidence based.
Yep.
And cancer is a thing where no one can really
knows what the problem is.
Exactly.
Or what it causes.
Exactly. So it's just one of those things where, look, you do what works for you.
Mm-hmm.
Oil pulling.
Yep.
Right. There's so many people that do oil pulling. They rinse with oil, and apparently that's supposed to reduce cavities, and coconut oil, something like that. Again, I don't know.
Yep.
Great. If it works for you, do it. Do it in addition to all the other things that are research backed.
Okay.
Right?
Yeah.
Whatever you want, it's your body, it's your choice. You can do whatever you want with it, as long as you're using your common sense.
Common sense is not so common there. It's like a deodorant. Those who need it don't use it. Trust me.
Again, with mouthwashes as well, right? There's certain things that are harmful.
Mm-hmm.
There are certain things, like for example, mouthwashes that contain alcohol, right? Alcohol-containing mouthwashes, there has been some research that has proven that alcohol-containing mouthwashes can dehydrate your oral mucosa and therefore put you at a higher risk of getting oral cancer, right? So there are some mouthwashes. So alcohol-containing mouthwashes should not be used as a daily mouthwash at all. Okay.
But non-alcoholic could.
Non-alcohol containing is fine. Another problem with alcohol-containing mouthwashes, which I just thought of as I was driving here, breath tests.
Yeah.
Random breath tests. So if you have a big swish with the alcohol-containing mouthwash, and if you get breathalyzed,
but then why would you do why would you just what do you say? Use a mouthwash and then go out. You would be doing this one at the end of the or before before the bed, right?
Depends, and that's the thing, right? Sometimes in the morning, people are this. Actually, I did not even realize that breathalyzer can pick that up until one of my DAs, dental assistants, her boyfriend, he had like when you have been caught for drunk driving for a couple of times, they put a little thing in your car which so the car doesn't start, you have to blow in it, and then you have that. So he had that.
Okay.
And then he in the morning he just woke up and he wanted to go get some milk or bread or whatever, eggs. Woke up in the morning, swished his mouth with the alcohol containing mouthwash, got in the car wouldn't start. So this is when, and this was like my first year of practice, and she told me this, and I was like, what? Is this for real? Because these are the things they don't teach you in the university, right? And that makes sense, because it does have alcohol in it, even though if it's trace amounts. If you do it and then straight get breathalyzed, then you could. If you do it at 10 o'clock in the morning, if you get breathalyzed at 4 o'clock in the afternoon, it's not going to do anything. But if you happen to do it just straight before, you can get in trouble. So that's the thing. And just in general, with using mouthwashes as a part of your daily oral hygiene regime, again, there's nothing against it, as long as, one, they're not alcohol containing. Secondly, as long as you're not substituting your brushing and flossing.
Gotcha.
Especially at night. Because what happens is, in the morning, people tend to brush. Most people will brush in the morning. They'll not, they won't give it a miss, because they're going out, they're going to speak to people, they don't want to have a bad breath. At night, we tend to be typically very tired. Most people will give at least flossing a miss at night. Some will say, oh, I'm too tired, I'll at least rinse with the mouthwash. I'm doing something, right? That's when it's harmful. If you're substituting, if you're doing it in addition to your brushing and flossing, great, no problems. I have no issues with it. If you're substituting your brushing and flossing, Yeah. You're not the only one. And that's why it gives you a false sense of security, right?
Of course.
So that's what it does. That's where I have an issue with it. Otherwise, I have no problems with mouthwashes. But there's mouthwashes that contain medication, chlorhexidine mouthwashes.
Yeah.
They're fantastic if you've got an oral ulcer, if you're recovering from a wisdom tooth extraction, if you've had a gum surgery, fantastic. You cannot use it as a daily mouthwash. Okay? Because it's a medicated mouthwash.
Yep.
If you use it as a daily mouthwash, it can stain your teeth, it can alter your taste sensation, it can do a lot of things.
Okay.
There's not enough warning on that bottle to say that you're not supposed to use it as a daily mouthwash.
Okay.
That's what I have issue with, right? So it's not the person's fault. They're going to think, oh, okay, it's an antibacterial mouthwash. It's going to help me. I'm going to use it.
Yes.
So those are the things where, again, if you see the dentist every 6 months and if you discuss these things with them, you'll rule out all of these issues out of your life if you have a dentist that you can have a conversation about these things with. So
Yeah. Okay, just lighten up a mood a bit now.
Okay. Sorry. Information
No,
overload.
which is good, which is absolutely amazing. What is the weirdest patient you had it in Australia?
Oh
a
my
weird
God.
patient. A story about a weird patient.
Okay. Okay, so this is not weird. This is something that sort of infuriated me a little bit as a parent. Right?
Okay.
Sometimes I get kids with caries that the parents refuse to treat and address because they think they're baby teeth and they're going to fall out.
Okay.
Okay. And it's not just here, it's also in India. It happens a lot more in India actually than here. But it does happen here as well, in every demographic.
Yep.
It's not just in a certain community or a certain cohort that it happens to everyone.
Everywhere.
Reasons are different. Sometimes people are just ignorant. Sometimes they feel like the baby teeth, what's the point? They're going to fall out anyway. Sometimes, the patients, the kids, I had a patient who had multiple caries, and then I asked them about their diet.
What is carie, by the way?
Caries is decay.
Okay.
Tooth decay, right? So I asked them about their oral hygiene habits, eating habits, things like that. They said, oh, my child doesn't like to drink water, so we always give him cordial.
What?
Yes.
Okay.
So it's better than not drinking water. We're keeping the child the child hydrated is what the parents' argument was, and sometimes they really don't know any better. But it's quite sad when things like that happen. Sometimes the parents say, my child doesn't like to brush. He just sit there and chews his toothbrush. You get in there and brush their teeth.
Okay.
There
are people like that then.
Yeah, absolutely. My son did not like to brush until he was 3. My husband and I would hold him down and brush it. He's not going to get traumatized. He's not going to hate his parents for the rest of his life because we forced him to brush his teeth. Once he gets old enough, he's going to understand that they did it for a reason. Exactly.
True.
So you don't have to let the child is not wise enough to decide for themselves.
Yep.
So you have to step in and say, right. You can say it in whichever way possible. You can say it the Indian way, my way or highway, or you can say it in whichever way you like.
Yeah.
It doesn't matter, but get it done. Because lots of, even young kids that have that sort of feed at night, whether it's breast milk or bottled milk, usually, the babies, they fall asleep whilst feeding. Or even like toddlers, up to 2-3 years of age, lots of kids, fall asleep drinking milk. And then they end up with what's called nursing bottle caries. Because what happens is when they suck the milk, it goes and sits behind your central incisors, your 2 front teeth, right, at the top.
Yeah.
And
the bunny ones.
Yeah.
Okay.
And those are the ones that get decays. Right? So you'll often see kids that have those 4 front teeth that have like cavities, C-shaped cavities in them, right? It's extremely common. And then they grow in size and they grow in size and they grow in size until the teeth break. And they're like, this tooth's going to, these are going to fall out. It's fine.
It's fine.
It's not fine. Because they can get infected. The patients only come when there's abscesses there. right? So it's better to treat it at an early stage rather than waiting for it to, those are the things sometimes we see patients that are always sipping lemon water, right? So they don't. So, and this is something that I only heard when I moved here. I don't like the taste of water.
So that's why they have lemon water.
Correct. So they just put a wedge of lemon in the water bottle.
Yeah.
Right. Even in restaurants, sometimes cafes, you
Of
see
course,
the little,
the jar.
and that has, lemons or strawberries or whatever.
Yes.
To flavor the water slightly.
Yes.
You're soaking your teeth in acid when you're doing that, right? Lemon it's got citric acid, right?
Yes.
So it's going to make your saliva acidic. Every time you sip it, you're making your saliva acidic. You're essentially soaking your teeth in acid. Please don't do that.
Okay.
When people are on diets, honey and lemon in the morning. Oh my goodness. Please.
I'm sure there are hundreds of people who would be doing it. Come on.
Do not do it, please.
Okay.
Because fermentable carbohydrate, honey, acid.
Yeah.
What are you doing,
Worst
man?
mixture.
Do not damage your teeth.
Okay.
And then
But
they
what
drink
about the
that.
water? What about with water? That's what people do.
What do you mean? Like, yeah.
You put honey.
Yeah. That's that.
Well, no, but there are people who put only in honey, they put little bit of juice and then they sort of suck it.
Yeah.
There are people in the warm water, lukewarm water.
So you're drinking it for a longer period of time.
Of course.
So you're chronically soaking your teeth. So all of these things, right? Whether it's sugar, whether it's acid, if the exposure is limited to a short period of time, okay, and then you rinse it out, you're fine.
Okay.
You're fine. You can have whatever you like. You can have a donut, you can have a cupcake, you can have sour worms, you can have snakes, right? I'm not talking about snakes. I'm talking about the candy snakes.
The candy snakes,
right?
yeah, of course.
Okay.
Yes.
You can have all of those things, and if you finish it off in like 10 minutes, rinse it out with water,
Yeah.
you're fine,
Okay.
right? If you have a piece, step away, go do your things, come back, have another piece, or have another drink of whatever, cordial or whatever sweet juice you're having. Every time you eat something, your saliva becomes acidic. It takes 30 minutes for the saliva to go back to normal.
30 minutes.
30 minutes,
Every
yeah.
single time you have something.
Correct. So, every time you snack, for the next 30 minutes, your mouth is at an acidic pH, right?
Okay.
So, your teeth are soaking in acid,
Yeah.
right? So, if whatever you have, if you have it in a concentrated period of time, rinse it out, you're fine. You can't stop living.
Yeah.
I'm not going to say, my kids love donuts and
Yeah.
cupcakes and cakes and, whatnots, ladus, burfis, everything.
Yeah.
They have everything. And you have to have everything. You can't stop living.
Yep.
But have it, one, in moderation. Secondly, have it all at once.
Have it in moderation.
And then,
Right. Okay.
and then rinse it out.
Okay.
And then don't brush your teeth for half an hour after that. After half an hour, you can brush. Because like I said, for half an hour, your saliva is acidic. If you brush your teeth when your mouth is acidic, you're actually eroding your enamel.
Ooh,
So you rinse it out with water, let it go for half
How
an hour.
many dentists
Yeah.
have told this part to their patients? In general. I'm sure you must have. In general.
Look, I love to yap away, right? So I speak a lot to the patients.
Should dentists talk about this stuff? Because honestly speaking,
Yeah.
this is something which every single patient should know about it.
Right.
So how would they otherwise know?
Yeah. Look, ideally, it is something that patients should be educated about.
Okay.
And it is something that should get discussed.
Okay.
Yeah.
Now my last question for this podcast.
Okay.
In our generation, let's
Right.
talk about the 80s and the 90s era.
Sure.
Prior to that,
Okay.
not many people had to do or put braces.
Right.
Okay.
Okay.
What has changed that these days 90% of the kids are not getting the proper teeth?
Okay. So there's a couple of things, right? One is the awareness has changed, right?
Okay. What do you mean by awareness?
So parents are more aware of their child's smile and the impacts of not getting the orthodontic treatment at the right time.
No, but we never had to. What I'm saying
But
is...
the standards have changed, right?
Oh, okay.
So, to me personally, a perfectly aligned smile is not something that's aesthetically pleasing to me.
Okay.
Okay?
Yeah. Everybody
you have
can't
to have
be a
little
Deepika
quirks.
Padukone. Come on, let's...
You have to, yeah. Look, Alia Bhatt has a slightly crooked lateral incisor. Everyone sees that,
Yes.
and we love it, right? She looks cute because of that. If she straightens it, it's going to take her charm away.
This dentist knows her Bollywood stuff.
Yeah,
All right,
yeah,
sorry,
yeah.
go ahead.
I am a Bollywood guy. but the thing is that, you have to have your little personality quirks. It makes you who you are. Everybody doesn't have to have straight teeth. But the expectation of the society today of having a perfect smile, perfect skin, everything, has changed. And I think the parents are more aware of these things. So the kids who are 10, 11, 12, their parents are our age, right?
Yes.
Late 30s, early 40s.
Yep.
So the moms are at that age where, are we getting old? Do we need to do any skincare? Do we need to do, we are at that age, right? Yeah. So we're looking at our kids and thinking, we want them to look a certain way. We want them to, so that awareness has changed. In general, the expectation of having a certain type of aesthetic has increased. Whereas not having perfect teeth or having crooked teeth or having, a
uneven
little bit
teeth.
of an underbite or overbite or whatever was just taken in a stride in the previous generation.
So the standards have changed.
Standards have changed. That's one. Number two, I feel like as we are evolving, the jaws are getting smaller, right? Because we're eating more processed food, right? So that's the reason why 3-4 generations ago, wisdom teeth removal wasn't such a big deal.
Yes.
Whereas 2 generations ago, all of a sudden, it started to become a really big deal because the jaws are getting smaller. They're not big enough to accommodate your wisdom teeth.
Yep.
Because it's like a vestigial organ, right? Your body doesn't really need your wisdom teeth.
Yep.
So another 100, 200 years from now, kids might be born without wisdom teeth, right? But until then, it's going to be a hassle, right? So that the changing shape of the jaw is also an issue.
Yep.
Early intervention orthodontics.
What is early? What do you mean by early?
So again, it depends on the case. Up until a few years ago, extracting premolars to create space for alignment was extremely common.
Okay.
Right? Now it's more about putting jaw expansion devices to accommodate the teeth.
More teeth.
So modifying the jaw to accommodate the teeth rather than the other way around.
Yeah.
Right?
Yes.
So all of these philosophies are changing. Therefore, early intervention is more common.
Okay.
So kids as young as 7, 8, 9 have started seeing orthodontists now. Sometimes the orthodontist, again, there's different philosophies. Some orthodontists like to wait more. Some orthodontists like to intervene early. The research is getting better. I was just speaking to a friend who is she's an orthodontist. She did her MDS from India as an orthodontist. She's practicing general dentistry here, but she also does some orthodontic work. She was telling me that she works with an orthodontist who picks up a lot of cases that have so their adenoids are large, right? So when the adenoids are large,
what is adenoid?
So adenoids are basically basically a part of the throat, right, from the inside that can block your breathing, right?
Okay.
So what happens because of that is the shape of the jaw changes, right? You tend to have a triangular upper jaw, right? And then therefore you can't breathe properly, and then you grind your teeth. So they remove the tonsils, they get the adenoids, the surgery, they get that fixed. It improves their breathing. They put a little bit of expansion device in their mouth. Arch is sorted. They're fixed.
Okay.
So this kind of research and this kind of early intervention, the awareness both on the part of the parents as well as the general dentist who picks it up and then the orthodontist who treats it.
Okay.
All of that has sort of changed. The perception has changed.
Yep.
But other than that, when a patient comes to me and they ask me if they need braces, there's aesthetic and there's functional, right? If you're doing it just because this tooth is a little crooked and I want perfectly aligned teeth, I say to them, please don't do it.
That costs too much.
Yeah, don't waste $6,000. Go on a holiday instead, right? But if it's functional, then you got to intervene, right? Like for example, in my family, on my mom's side, everyone has a deep bite. Deep bite is when your top teeth are really, So normally your bottom teeth, your top teeth are supposed to glide on top of your bottom teeth.
Yes.
And there's supposed to be about 2 millimeters of overlap. Deep bite is when instead of 2 millimeters, it's 3, 4, 5 millimeters, right?
Okay.
So that's a deep bite.
Yes.
With the deep bite, again, personally, I think it kind of looks cute. But provided it's functional. Like for example, my mom has it, my grandmom has it, my great-granddad had it, everybody in my
hereditary.
family. Yeah. My sister also had it. So no one else had orthodontic treatment. But with my sister, what happened is this was actually pushing down on her lower gums. And it was causing inflammation and swelling in the gums and it was painful. So we had to then open her bite to kind of
accommodate
exactly. So then when it's like that, when it's a functional thing, when it's where it's going to affect your bite, it's going to, sometimes it can affect speech.
Yep.
Sometimes, there's lots of things. It can
Yes.
affect your posture.
Yep.
Right? It can affect the muscles in your jaw, your neck, everything, When it affects all of those things, then then it is something that is essential. If it's just because, I've got a little bit of a crooked tooth there, I've got a little bit of a gap there, it's you. It's what makes you. You got to live with it.
Now, oral health.
Right.
Is there any correlation with the physical and with the mental health?
100%. 100%. So there has been a lot of research that says that gum disease can actually cause a lot of other systemic diseases like cardiovascular disease. It can actually, if moms have gum disease, they're more likely to have preterm babies, low birth weight babies. So there's a lot of correlation there. Oral health can sometimes be an indication for a systemic disease.
Okay.
Right? For example, bad breath, right? Bad breath, most of the times it is because of the plaque in the tartar. Because the bacteria in the plaque in the tartar will produce some gases that are foul smelling, therefore you get bad breath. You remove the plaque in tartar, bad breath's gone. Sometimes you can get bad breath because of other conditions. Like for example, sometimes, if you've got diabetes, you've got a certain type of breath. If you've got liver disease, you've got a certain type of breath. If you've got gut issues, you've got a certain type of breath.
Yes.
Right? So those can actually be indicators that something's not right.
Wrong.
Get it looked at.
Yep.
Right?
Yep.
As far as mental health is concerned, again, oral health can indicate how the mental health of the person is right? Because a person who's depressed is quite likely to not be brushing and flossing and looking after themselves, right? So sometimes I see patients again who have been with me for a couple of years, and you won't pick that up when you see the patient for the first time.
Of course.
Right? Because you don't know what their oral health was prior to it. But if you're seeing the same practitioner for years and years, they know what your mouth looks like, they know what your teeth look like, they know what your oral hygiene regime is. And then all of a sudden, if they see a difference, they're like, oh, hang on, what's changed? What happened? And then something comes out.
Okay.
Yep. And vice versa. If you have bad teeth, it can affect your confidence. It can affect your...
People talk about it for hair as well. Come on.
No, but look,
it's subjective.
It is extremely subjective, and it is how you take it.
Okay.
Right? There are some people that genuinely do not have the confidence to smile because they have been too scared of the dentist,
yes.
or they didn't have the money to do it, or they thought that to improve their smile they need to spend thousands and thousands of dollars, and they don't know that there can be some easy fixes, some little things that can be done that are not necessarily very expensive, that could improve their aesthetics, and there is a way out.
Yep.
You know.
Yep.
so then, so that can actually give them the confidence to smile. On the other hand, there are some people that actually have a fairly decent smile, but they're never happy. Those are the scariest patients, because you can never please them. Doesn't matter what you you're not one of them. Don't worry.
I hope not. Thank you.
You're very easy to please.
Thank you.
No, you're fine. But there are people that you can tell, right? There's this patient that I had, young girl, mid-20s, really decent smile, no problems, Oh, I want perfect teeth. I want to go to Turkey and they're going to do 18 crowns for me. Me and my dental assistant, he was also an overseas dentist,
yes.
Indian dentist. We're both looking at each other. We're looking at her. You're like, okay, how do I say it in a way that is gentle?
You can't.
Please don't do it. Please don't do it.
You can't be gentle all the time.
Yeah. So, there's some people that genuinely, again, and that's also an indication, some people do have body dysmorphia. They're not happy with their appearance. No matter what you do to them, they will never be happy. So yeah, it is interrelated, both general health, mental health, vice versa. So yeah,
awesome.
It's all
interlinked.
Yeah, interlinked.
Excellent.
Yeah.
Well, thank you so much, Neha. You have given much more information what we were looking for, and we are grateful because the thing is, sometimes if I've come to your clinic, you probably have max 30-45 minutes.
Yeah.
How much time we're going to talk about
Correct.
it? There are different things which most of the people are even sometimes not aware of.
Correct.
So this podcast, I'm sure if people listen properly, then they'll understand that there are so many other aspects of oral health which are sometimes interlinked, sometimes different than which you have not thought.
Yeah.
As she said, don't go out by taking alcohol mouthwash, because of course it's going to come out in your
and
breath
don't drink
analyzing.
and drive either.
That I don't know. I'm not here to say that. But at the end of the day, I think you've covered most of the things which a dentist would and should say when they're in clinic. But sometimes due to the time constraints different things,
it's hard.
It is hard.
Yeah.
It is hard.
Yeah.
So really appreciate your time.
Thank you.
If there are any questions which people have, you can definitely put it in comments, and we'll go back to our dentist to reach out and to ask those questions.
Absolutely.
Because in that 45 minutes, an hour, we can't cover everything.
Sure.
So we try our level best to get as many questions and answers as possible.
Yep.
But people, if you have any questions, feel free to reach out, and thank you so much.
Thank you
Really
so much for
appreciate
having
your
me.
time.
It's always lovely talking to you.
Thank you.